As a new year dawns, there are some promising signs of progress toward achieving our nation's goals for the prevention, care, and treatment of both HIV and viral hepatitis. For example, according to the latest numbers from CDC, the proportion of the 1.2 million individuals living with HIV in the United States who have been tested and diagnosed has risen to 86%. That's up approximately 5% since 2006. This is especially encouraging because diagnosis is the entry point to comprehensive care and treatment that allows people with HIV to live longer, healthier lives and to reduce the likelihood that they will transmit the virus to others. Another example can be found in a White House report released on World AIDS Day. Although we still have much work to do to achieve the vision of the National HIV/AIDS Strategy, this report showed progress, including increases in the percentages of men who have sex with men, blacks and Latinos who have achieved a suppressed viral load. Not only does this improve individual health, but it also reduces the likelihood that HIV will be spread to partners. And with the advent of new curative treatments for hepatitis C, efforts are underway across the public health community to support implementation of the CDC and the U.S. Preventive Services Task Force screening recommendations so that we can diagnose infected individuals in a timely manner and refer them to care for their viral hepatitis. All of these advances are noteworthy and commendable and reflect the hard work of communities and providers across the United States. But we have to be honest that challenges remain and that there are critical areas where we must continue to focus our attention if we are to achieve our national goals. Among the actions we can all take in the coming year are continuing to make strides in both HIV and viral hepatitis testing and diagnosis so that more individuals have the knowledge they need to preserve their health. Accelerating our efforts to improve outcomes along the continuum of care for both HIV and chronic viral hepatitis. This means working both with communities as well as providers and policymakers to ensure improved access and better health outcomes. Sharpening our focus on applying effective interventions in communities and places that remain at highest risk and that face the greatest disparities in incidence, health outcomes, and mortality. For HIV, this means sharpening our focus on gay and bisexual men in all racial and ethnic groups, women and men of color, young people, and transgendered individuals. Continuing to confront the stigma that sadly persists for both HIV and viral hepatitis and still prevents too many individuals from seeking a test or pursuing care and treatment. I hope that you will join me in recommitting to taking on these important actions that will help us achieve our life-saving national goals for HIV and viral hepatitis. Working together, we can build on the momentum generated by our work of the past year, and in the new year, tackle the remaining challenges with creativity, fortitude, and conviction. Thank you, and God bless you and your loved ones.